Our project is titled Improving Childhood Vaccination Rates and Continuity of Care in Recent Immigrants from Central America by Adopting a Vaccine Catch-up Plan Sheet at the Kansas City Health Department. This quality improvement project was conducted at the local health department due to a lack of tracking ability with the current EMR system in place at the vaccination clinic. For patients who only require a single flu vaccine to remain up to date, this is not a problem. However, difficulties arise when newly arrived immigrant children who each require a specialized vaccine plan to catch up on their required vaccines. Because of this, a vaccine catch-up plan sheet was created for a simplified tracker used by both the nurses who administer the vaccines at the health department and for the patients to track future appointments and which vaccines will be given when. We tracked the data of recently immigrated children from Central America with unknown vaccination status receiving vaccinations at the local Kansas City Health Department. This vaccine clinic is managed by nursing staff under standing orders from a physician medical director. Due to clinic volume and staff turnover, patients may see a different nurse at each visit, creating a need for records that can be shared between patients and nurses. A VCP was created for 25 pediatric patients beginning at the vaccination process where their individualized vaccination needs were mapped out per CDC guidelines to assist with future scheduling of appointments. This sheet was provided to the patient's caregiver at the end of the initial visit and added to the patient's chart. The VCP was then used as a reference by the nurse providing immunizations during subsequent appointments. From the data of 25 patients, we were able to track the follow-up rate of patients as they attended their appointments. As we can see from the graph, 19 out of 25 had attended their first follow-up, and 15 who were scheduled for the second appointment before this data was gathered, 11 of those had attended their second appointment. While we do not have a baseline attendance rate to assess improvement, we hope to continue to adapt the VCP and reassess performance based on this data. Some changes that we are looking to make include having an Excel sheet auto-populate appointment times based on standardized windows between vaccine administrations. We hope that this improvement will make deciding which vaccines to give and when less confusing for both the nursing provider and the patient. In conclusion, due to their legal status and recently arrived immigrant children often lack insurance and a medical home, and thus must frequently rely on health departments for immunization needs. Language barriers also contribute to the confusion surrounding follow-up appointments. Often, electronic medical records used by the health department is less robust and limit guidance for future scheduling and administration of required vaccines. Thus, vaccination timing and spacing may be differently interpreted by each nurse. Although completion of a VCP takes months, we have early data that an easy-to-read, organized VCP is a simple standardization tool that could increase vaccination rates and continuity of care in this population. Use of a VCP has implications not only to ensure a vaccinated population, but also allows for easier transition to public schooling and ease for parents to understand the child's vaccination plan. We hope that continued improvement of the vaccine catch-up plan will allow for increased compliance and easier communication between providers and patients and their parents. Thank you.